This question is: a 43-year-old woman complained of the persistent stomachache with a recurrent pain attack and nausea, vomiting, with a stagnant bowel content, and abdominal distension and the flatulence. And Nero has been presenting with the sign of for the 7 hours, and pulse rate is 116. The tongue is dry and brown. Abdomen is symmetrically distended, soft, painful. Percussion reveals the tympanitis, and auscultation the bowel sounds metallic overtones, splashing and dripping. Make the diagnosis. Okay. So to approach this particular type of question, you have to be very clear with the with your concepts that there is a 43-year-old woman having the stomach, or you can say that there is a persistent stomach ache with a recurrent pain attack. Okay. And the bowel content is there is stagnant, which is stationary, means that it is very slow, and abdomen distenses. Without looking at the option, you can make the diagnosis very quickly that percussion there is a tympanitis. Tympanitis is a stand when there is a hollow sound. Hollow. Okay. This is the same concept which I have told you while percussion the lungs, and the same thing here. And there is a metallic overtone, splashing and dripping. That metallic overtone itself is stands for the here some sort of hollow structure or hollow organ, and there is splashing and dripping. This splashing and dripping sounds are listen when there is obstruction. In the given option, only one given, only A is having the obstruction, so this is the correct this is your correct answer. But if you want to look at the other options, like why they are not right, so now see, listen. Here, the second option says the acute non-specific colitis. Colitis here, or it can be the ulcerative colitis or GERD. Two option will be there. Either it will be GERD or ulcerative colitis. So their symptoms are like related with the fecals and lower leg pain, left one, and then there is a problem with the stool. Okay, and the third option, acute necrotizing pancreatitis. Pancreatitis, inflammation of the pancreas. Necrotizing means there is a cellular death. So what will happen? The function of pancreas will be affected. So the patient will have a complaint like there is a lipase, or there is a fatty droplets or lipid droplets with the stool, or there may be the associated problems with the sugar metabolism or the lipid metabolism. The third one, esophagitis, it is somehow related to the ulcer. Okay, so the patient will have the complaint of the like burning sensation, blood loss, anemic symptoms, and this will be related with the esophagitis. And the acute destructive cholecystitis, this destructive cholecystitis patient will have the one localized pain, because given here the symmetric, see in the question there is a symmetrical distension, but in case of a cholecystitis there is a right hypocolic. So if this is a chest and you look at here, so the pain will have basically localized here, and the right shoulder pain will be given in the question, and the patient may have the symptoms associated with the feeding or the food consumed by him. So the given answer for this question is acute intestinal obstruction. Obstruction explanation I have given. Why intestinal? Because the bowel symmetrical, abdomen having a symmetrical problem, and that is distended. So that is why it is the intestinal problem. Why it is acute? Because it is only 7 hours when she is having the complaint. Okay, now moving to the next.